The dental core training is sort of another step after your foundation training. It used to be called an SHO post and then it became Dental Foundation Year 2 post. It's only this year it's been amalgamated to form dental core training years 1, 2 and possibly 3. And it's great for new graduates who want to carry on in a training and learning environment after they've finished their foundation training.
So I think I decided that you had your entire career to go into general practice, and I didn't feel I needed to jump in straight away after DF1. So I thought I'd rather get an experience of doing something a little bit different, and you can always go back to general practice later. I also talked to quite a lot of associates, other general practitioners, who said once you're in that general practice job, it's very difficult to get out of it, mainly because of the income, the reduction in income going into a hospital job. So it's almost a bit of kind of now or never with a hospital job.
For me, I wanted to keep my options of specialisation open. I'm quite interested in restorative, and to be able to explore that pathway, I thought DCT is what I need after my DF1 year. I could have gone into general dental practice, and that's still a very viable route, but to actually get to where I want to potentially go, then I need to at some stage do dental core training.
Well, when I was doing DF1, I sort of missed the hospital setting and I missed all the people. I found practice a little bit lonely. I mean, my training was very nice, but I did sort of find it quite lonely there. I just wanted to be back in the hospital setting, and I thought maybe get a bit more experience, particularly in oral surgery, because that's where my sort of weakness was during DF1. And I suppose I just wanted to maybe specialise in the future, so I wanted to go back into hospital because of that.
I love general practice and I had a really good year with PT, but I wasn't sure whether I wanted to go straight into that only general practice for the rest of my life kind of thing.
For me, I think the most important thing was just basically getting something more than just what I've been doing for the past year or so as a VT. So just a little bit of experience in a different aspect of dentistry, or just experience with cases that are slightly out of the remit of general dental practice. So that's why I kind of went for it.
New graduates who want to carry on in a training and learning environment after they've finished their foundation training, and they get exposure to lots of different aspects of dentistry. Most of the dental core training programs are broad-based still, so it's great if you're not quite sure if you want to specialise or not. You can get a taster session in most posts.
You have to be doing it for the right reasons. If you think going into dental core training is going to make you a better general dental practitioner, yes, I agree, it may do, but being a general dental practitioner is going to make you a better general dental practitioner. So I think you've got to do it for the right reasons. If you're not sure, then definitely apply, because I think it keeps your options open. If you're generally not sure what you want to do, then there's nothing you can lose, only something to gain.
If you're not sure, definitely apply. As Jazz said, 1 year is not going to. I hope it doesn't detract from anything in general practice, but definitely give it a go. It's not going to be anything but valuable.
I work part-time in practice as well, so I do a Saturday job in practice, and that's actually the same practice I did VT. And that obviously really bolsters your CV in terms of getting an associate job after a hospital job. And there will be always some practitioners, some principals who have the opinion that people coming out of hospital won't be as good in general practice because they've slowed down or they're not used to that system. Fortunately, you can't ever change that mindset. I guess when you're applying for those jobs, you've got to make it show that what you learn in hospital will benefit that practice and will benefit your patients in that practice.
There have been a huge increase in interest in dental core training, and therefore the number of applicants is, we had an unprecedented amount last year. It is really difficult. That's a very good question, because at this stage in your training, everybody has fairly comparable experience. The undergraduate programs are all excellent. They're all standardised to a curriculum within which you've probably all done an audit project or a research project. But extra things, extra strings to your bow could be presentations, articles that you've written up, maybe even a case report, something that stands out as a little bit extra above and beyond what you've been exposed to.
Do it on the day it opens. Don't take chances. If it's a personal statement kind of section or those kind of questions, obviously spend a lot of time writing down those things. Again, look at the specification. all the answers are right there. It's telling you what to write. Make sure your answers match that specification. Talk to your DF1 trainer. They've got a lot of experience. They'll be able to tell you if you're way off the mark.
There are certain buzzwords. Include as many of those buzzwords in your application as possible, and so at least they can see that you've thought about it. That's probably the main thing I remember.
Somebody who comes across in a very genuine, honest, open way really has the ability to style, because they can then just allow the panellists to see what their drive and motivation is.
You try to prepare for questions that you think they're going to ask you, such as why DCT1, why not associate. I know in my interview I got asked a lot about an audit project that I did, so try and talk with your trainer about that. Also have a case presentation available that you've done in DF1. Know the difference between audit and research. That's quite a standard question. The interview for me was very similar to DF1, so look over your clinical governance, the GDC guidelines, all of that comes up again. And the best person to ask, probably your trainer or scheme advisor, because they know more about it. And if any changes are happening, yeah.
The first thing would be, do your research. There's tons of information on the internet about, what the interview will, contain, what the questions they're going to ask you, what the structure is. The personal specifications are really good piece of information that gives you basically all the answers you need. So get as much information you can. Talk to your friends in years above you who've done interviews. Try and get as much information before you step in there, so you're as prepared as possible. The other thing would be preparation in terms of practice. So you'll have friends who are applying as well. So you get some friends together, have a little practice. If you don't have any friends, practice in the mirror. You don't want to feel natural on the day.
So I think probably the most important thing is just to realise that actually they know everything already. They've gone through interviews so many times, and it's all about just keeping your confidence and just being ready for the actual interview. Just having everything sort of ready at the back of your head, just ready to pull out and just present it in front of them, really.
Smile, and obviously look the part. Don't turn up looking scruffy, and smile mainly.
With me, I felt that it was actually quite similar to the sort of interviews that I'd done for just for VT as well. So the notes that I'd made for that I thought were quite relevant to what I was doing this time as well. And then also, in addition to that, I think just talking to my colleagues, talking to my friends, there's so much to learn off them alone, and also just talking to my senior colleagues as well. That was quite useful for me.
I didn't really use much reading material as such. Maybe I pulled out my DF1 notes again in terms of my preparation. I would have done the whole consent and mental capacity, all those little hints and things, and the dental legal advice, which can be very, very useful.
I'm really enjoying it. I think it's a really good job to do. I've learned so much even just 6 months. Working in that different environment as well has complemented my foundation training really nicely as well.
And the other thing to mention is that from next year, dental core training recruitment will be a national process, so everybody will be interviewed in one go, in one locality.
So just a big good luck to everyone, really.